Hello everyone, welcome to Doctor's Care Consultancy and Counseling Service, where your medical and mental health is a priority. You talk and we listen. Welcome to this program. My name is Dr. Agatha Ehiremenwakeze. I'm here to talk to us about breast cancer. Breast cancer has become so common everywhere, especially in our country, Nigeria. Is actually posing a menace in our society, especially among our female folk. So that's why I'm here to talk about it. Why am I talking about it? Early detection is a key, because once it's detected early, it's treatable. It's very, very treatable, it's manageable. So that's why I'm here to talk about it. I wouldn't want to bug us with a lot of medical jargons about breast cancer. I'm just going to take it simple and step by step, because after talking about this breast cancer, we are going to talk about breast self-examination, which is exactly the key to early detection. Okay, before I start, what is breast cancer? All right, let me give us an insight what cancer is all about. You know, human cells divide every day. There's cell division going on in your body every day to replenish the old dying cells. But somehow, in a way, these cells start dividing abnormally, in that there is no control anymore over that division. So those abnormal cells start dividing, forming a lump, trying to take over the normal cells in the body. And when this issue occurs, when this situation occurs in the breast, it becomes a breast cancer. You know, there are so many places where this abnormal division of cell can occur, or where this cancer can occur in the body, in the breast, giving us different types of breast cancer. I don't want to bore you with types of breast cancer, but I want us to go straight into the causes of breast cancer, or should I say the risk factor of breast cancer. Risk factor is anything that makes it more likely for one to get breast cancer. Okay, so what are the risk factor of breast cancer? The risk factor of breast cancer is, once you're a female gender, you're likely to have breast cancer. Okay, so breast cancer is seen more in female than in male. It's stipulated that one in every 8 female is likely to have a breast cancer. 1 in every 8 women is likely to have breast cancer, where 1 in 1,000 male is likely to have breast cancer. So you can see, once you're already a female, there is that risk factor of having breast cancer. Then decreasing age. Yes, I remember when I was in school, they said decreasing age. Once your age above 40, 50, the person is at risk of having breast cancer. But we see breast cancer even in 20s these days, 20, 30s, you see breast cancer. But increasing age also is a risk factor for breast cancer. Okay, then we have family history. Once you've had a mother or a grandmother that have had breast cancer, you should be on a lookout for it. You should be at an alert that it can occur. There is that family history, there is that family lineage. Once your relative, your grandmother, your grandparents, or your mom have breast cancer, there is that risk, there is increased risk factor of that person having a breast cancer. Then radiation exposure. Some people that have gone for x-rays, you know, on the trunk, on the breast area repeatedly, it can predispose one to having a breast cancer. Obesity also is a risk factor for having a breast cancer. So ladies out there, try to work on your weight if you're actually obese. Okay, then we have also menarche. Menarche is an early age of starting your menstrual period. You know, those that started their menstrual period early in life, maybe at age 7, age 8, they are prone to having breast cancer, or they are at risk of having breast cancer. Then late age of delivery, people giving birth at a very late age in their life, can also predispose one in having breast cancer. So those are alcohol also. Those women that are always takes alcohol always or all the time, they are predisposed to having breast cancer. And also Smoking can also predispose one to having breast cancer. So now we've seen the risk factor. That sometimes they will say that maybe if your parents have breast cancer or if your mom have breast cancer, does not really mean you may have breast cancer in life. But we are trying to tell you all these things so that you'll be aware of them and also try to look out for all this. And also, like I said before, breast exam is the key. I'm saying all these things and I'm actually taking us to somewhere so that you look out for this, so that you have this knowledge, at least have it at the back of your mind, that these are the risk factors for breast cancer. Now, what are the symptoms of breast cancer? I don't want to say symptoms of breast cancer because these symptoms may be there. It may not actually mean that one have breast cancer. I'm telling you this so that when you notice all these symptoms in your breast, don't panic. You don't need to panic, okay? You go and see your doctor. There are some signs, all these signs you may see in your breast. They may be a simple mastitis, just inflammation of the breast. They may just be a fibroadenoma. This is a kind of lump in the breast that is not cancerous. So why I'm saying this is that when you see all these symptoms, quickly go to your doctor for examination and for testing to find out exactly whether it's breast cancer or not. I'm saying this because it's not all signs. When you see all these signs, does not mean you have breast cancer. Okay, so these are the symptoms of symptoms you see in your breast that is a pointer to you for you to see your doctor and try to sort out what exactly it is and then go for treatment. Okay, when you see a new lump in your breast, when you check your breast, sometimes you find this out when you do your self-breast examination. There is a lump in your breast or a hard mass or a hard substance, a hard feeling in your breast, or not just in your breast, your armpit as well. Please go see your doctor. When you have pain, excessive pain, because sometimes some women, when they are menstruating or when they are ovulating, they feel pain in their breast, but that pain is not a severe pain. It's a pain you manage. It's a pain you can still go about your normal business. That pain also disappears immediately after your ovulation or immediately after your menstruation. But if you feel any pain in any part of your breast that is not related to your ovulation or your menstruation, please go see your doctor. Then if you have any swelling anywhere in any part of your breast, be it your areola or be it the main breast, please go see your doctor. If you feel any redness or any discoloration around your breast that is not the normal color of the skin of your breast, please, is a symptom, go see your doctor. Okay, if you have any pulling, your nipple, female nipple most of the time is out, is what we call everted. But if your nipple has been everted and all of a sudden you notice that the nipple is inverted, is going inwards, nipple most time is always out, but when it starts going inward back into the breast, it's also also a red flag. Please run, go see your doctor. Most times you see, if you're not a breastfeeding mother, if you're not lactating, if there's any other discharge from your breast, whitish discharge, darkish discharge, bloody discharge, yellowish discharge, please, that is also a red flag. So all these things, most times if you have pain in your armpit, or you feel maybe a lump or a hard mass in your armpit, it can also be a pointer. Please go see your doctor. Then if there is any change in shape of your breast, when you're growing up, you already know the shape of your breast. If you notice there is a change in the shape of your breast, go see your doctor. Then sometimes if there is dimpling, in the skin of your breast, you see a kind of dimpling, we call it the orange back. You know how the orange back is, the dimples on the orange back. If you notice any of such sign in your breast, please go see your doctor. Then if you have any dragging sensation, sometimes you feel this dragging sensation in your breast, please run, go see your doctor. Then if you have any scaly lesions around your areola is that black part around your nipple before your breast the nipple is there, then the black part that follows it before the main breast, that's where we call the areolar tissue. If you notice any cracking or any maybe rashes around that area of your nipple, please go see your doctor. In fact, if you notice any change at all in your breast, go see your doctor. It's a red flag. I think this talk now is enough to help you to know that, please, you got to be aware. You have to be aware. In fact, make your breast your friend. Be friendly with your breast. That's what brings me to self breast examination. You have to know your breast, like the palm. You know, sometimes people will say reading your palms. When I tell you I know the signs or the lines in my palm, please get friendly with your breast, because most times is when you get friendly with your breast, you're able to notice all these changes and go. Last week I saw a lady that came into the clinic. The lump in the breast, if I'm not exaggerating, is up to this fist of my hand. Okay, we got talking. I asked her, why would you allow this lump to get up to this size before coming to the hospital? She said, doctor, when I noticed it, it was small and I thought it was going to disappear. My dear, that lump was big and already it has started drawing the skins of the breast. In fact, though I've sent for tests, we are still waiting for the result. I bet you that lump was massive and also have changes already around the nipple and in the areola. We are praying that it might not be cancerous, but for a lady of that age to leave that lump up to that size, my dear, at the point I was wondering why. I really don't know what she was doing, kind of feigning ignorance about it. This is not the right thing to do. When you notice any little lump, no matter how little that lump is, please go see your doctor. It's very, very important. I really don't want to make this a long talk. I will have to stop here. In my next section, we are going to do a self-breast examination with the demonstration. So I want to leave you all here. I hope you enjoyed this talk and actually use it. Let it be very, very beneficial to you. Thank you so much. Remember that you talk, we listen, and your medical and mental health is our priority. Thank you very much and have a wonderful day.